So Julie, thank you so much for speaking with me today.
Oh, thank you. Thanks for the opportunity.
So tell me, you are both a clinician and an officer. How do those two combine to inform your perspective on the healthcare industry?
So I spent most of my career as a full-time clinician. And the primary angle of my practice was health behavior change. And so really that's about understanding people's motivation, what they value, and then helping them navigate through really complex and difficult change in their life. So I think it fits really beautifully with how we think bigger about patient experience. And so I think that if I weren't a clinician, I wouldn't have that same perspective. So I think it keeps me grounded in the work that we're trying to lead in patient experience and intimately connected with patients and their perspective, as well as the insights that they share about where we need to go next.
That's wonderful. It's wonderful that you feel that they're so integrated. So what do you think are some of the biggest challenges confronting the healthcare system right now?
I think there's lots of challenges. I think one that keeps me up at night, or that I think a lot about, is as we move more and more towards technology, how will we serve the diverse patient population that we have, and keep it personalized and get it closer to their own homes. And so for me, I think a lot about even the county that we're in, and just the alarming numbers of people that don't have access to the internet or don't have data plans that can support logging onto the portal to engage in their own health. And so how will we design systems and processes and experiences that everyone at any stage of their health and any community can connect with us?
That makes a lot of sense. And so what are you most excited about in 2019?
I think there's tons to be excited about in healthcare. One, I think that right now, certainly in my career, this is a time where we are ready for change. And people are saying, you know what, we're not going to take this. We're not going to do this anymore. We are going to demand that we disrupt the system. And so that gives us tremendous opportunity to do just that.
What aren't we going to do anymore?
So I just think challenges with our patients and holding us accountable to provide access, to provide exceptional experience, to provide high quality care and value, as well as our own providers and clinicians, to give them a work environment that they can thrive in, and that they can do the work that they started their career to do, and connect them to that. So that's exciting to me, and I think we're pushing the envelope. So in pushing back on the technology systems that we use and asking them to design it, one, with our patients, but two, setting some expectations for what we need and how we want to use that. The other thing that I think is really exciting is the collaborations. And so I think our ability to partner tech solutions in connected ways for patients is exciting to me, and to be very thoughtful about what is the interconnected experience that we're creating and what is the enablers to do that. And it's not necessarily just one thing. It could be a series of things, and it's going to be personal to our patients. So we might have some for some patients, some for others, but we have to understand and know our patients, and then to be creative in how do we design that experience together. So I think that's exciting.
To be excited about.
I think it's exciting. I think it's a lot of work and exciting.
You work in the field of patient experience. It's kind of your area of expertise. So in terms of patient engagement, what are some of the hurdles that have traditionally existed between patients and health systems, and how are those relationships changing over time?
It's a great question. I was in a session yesterday, and we had a conversation about engagement. And often that conversation ends with, we need to change someone's behavior. And so we're making a lot of assumptions around engagement. One, that someone actually wants to change something in their lives. Two, that we've given them enough information to even make a decision around changing. And so I think it's grounding, and I think it's important, and it emphasizes the need for us to be effective in our communication with our patients, right? To really understand, what do they value? What do they need from us? Have we provided them information in ways that they can digest it and do something with it? And then have we given them a chance to have a choice in it? And so that we are really partners in walking through this journey together. So So that's maybe a monologue about that. But I think it also has us think different about what does engagement mean. And I think that that's really important because engagement might mean something very different to the different people that we serve. And it's up to us to know them and then to create pathways and partnerships together with them that we both agree on.
So maybe some of the traditional ways that we measure engagement aren't necessarily right for patient population.
I think it's the solutions. I think we can measure engagement, and there's great, right, validated scales to do that. I think how we think about engagement sometimes feels very narrow. So, engagement, we had so many people log onto our portal. But if they log into our portal and they don't actually connect to the information that's in that, they don't work with that information or engage in that information to improve their own health, then what have we actually done outside of send you to another spot with another login? So I think engagement means that we're helping people navigate what they want to navigate. And I think that that's going to be a more complicated solution. And probably a series of solutions. And we talked a little bit about this yesterday, that I haven't seen that solution out there. I think that hopefully is still coming. And I think there's one part of that just relies on us to be able to better understand our patients and what they want and need
that makes a lot of sense
from us. And so if I think about, to get back to your question of what do we need to do, I think there's some simple things that we need to do. Healthcare is ridiculously complex, and I think we need to make it easier to connect to healthcare. And from the moment that you have a symptom to how do you get to your first appointment, but not so siloed intervention. That the dream would be that we are walking through that journey with you, and that we're proactively touching you in moments that we need to. And creating that experience across a continuum of care, that we're partners in this, and it's over the course of your life, not just one episode at a time.
So what are some of the things that we could do to participate in that journey? What would that look like?
I mean, I think we need to be thoughtful about how we provide access, and I think there's great work happening out there around providing access that's anywhere, anytime, in your home with virtual visits. So I think that's really great progress, and that's something that's so important. I think there's one part of it that is, so simplifying the system, one part. I think there's another part that's around just helping us better know our patients, right? And communicating with each other in ways that derive meaning and purpose. So I think those are huge, and I think how we work together to get there. I think there's one part of it that's very much patient-facing and helping patients understand their own journey and what to expect and what's coming ahead for them in their care. But we also see that same pain point with our own clinicians, that we tend to work in departments or in institutes and it can feel disconnected from even each other. And how do we best provide care across different service lines, across different departments, and how do we know where the patient is once they leave our office and connect back to that? So I think it's really twofold, that there's a desire that we know that journey better, we can walk it with you, even if it's leveraging technology.
That's a wonderful idea, a wonderful way to look at it. So what can health systems do to cultivate patient engagement and satisfaction? What are some of the most important steps that they could take?
So without being too redundant, I would say making it easier for patients to navigate the system of healthcare. I think simplifying not just like how you get to us, but also all the information and the content around what you value and what you need to know or want to know. And so I think of the big buckets, if you think about the big opportunities, a lot of that falls around communication. But we also know there's huge buckets to improve, like access, communication, because the moments that matter most to our patients are their actual connections with nurses and doctors and other providers in that space. I think we have a lot of work to do around how do we discharge you to the next step and what that looks like. and then how we connect with you proactively. So I think that that's a real missing link that I see, and a lot of it is how do we stay connected in the times that you're not in the hospital or that you're not physically here seeing a doctor. So how do we stay a partner in your care? So those would be the biggest buckets that I see the next 5 years looking at.
That's wonderful. So when you look out at the future of healthcare, what do you think really will be different over the next few years? How do you think it's going to look different in 5, 10 years?
I think it will be intimately personal. So that care is around that one person that's sitting across from you in that room. And it's because I know you, and I know your values, and I know what you want and desire. So I think it'll be deeply personal, hopefully deeply simplified. So someone recently told me, and I'll start to you, that wouldn't it be great if, like, I walk through the airport and I go through that scanner and they check me. What if that were my primary care visit? Like, I just walk through the scanner. I don't have to make the appointment. I don't have to go to the labs. I don't have to go do the testing that you asked me to do, but I just walk through it 2 seconds later and I'm out, and you just send me whatever I need to know. So that's very far-fetched and a little bit dreamy and not very personal, but that, that's their own desired experience. But I think the future is about coming to people where they are, caring for this one person in the way that they want to be cared. So the scan works for them. They don't necessarily want to be in the visit in the office with you, and that's okay. So I think anytime, anywhere, probably much more at home and not in big buildings that feel impersonal and difficult to navigate.
That's a very positive vision of the future.
My airplane scanner.